started. Okay. So the first couple slides are just slides that I want you to pay attention to so that you know exactly what these items are. So the first one are the hallmarks of osteoarthritis. So you'll see that in osteoarthritis, you'll either have Herbedens or Bouchard's nodes. The Herbedens are in the proximal joint, so proximal meaning that it's closest to the body, and the Herbedens are in the most distal joint. They have those bony outgrowths. So I just want you to know the location of these nodes and their orientation as well. Okay, so you'll find these in patients that have osteoarthritis. So the next one is deformities that you might find in a patient who has rheumatoid arthritis. So what is this deformity called? What is that? What's that deformity called? Yes, the swan neck deformity. Very good, Zenaida. And what is this deformity called? The second to the right of the swan neck. What is that deformity? Well, it tells you right there, huh? So it's the boutonniere. Yeah, it's the boutonniere. Remember the little corsage that guys wear? That's a boutonniere. So this is the boutonniere deformity, and this is the swan neck deformity. This picture here gives you both of them, and it depicts it very well. So do you guys know what this deformity is here on the left? The ulnar drift. Very good. So the fingers are going to drift laterally outward. So that's very good. And so what is this deformity? Really, we're looking at this right here. This also is a lateral drift, lateral deviation from center, but we're really looking at hallux valgus, which is commonly referred to as a bunion. Okay, so what I'm going to do for the remaining slides, there's a couple slides in here I also put on here for you because it compares and contrasts the different types of arthritis for you to look at down the road. But for the most part, these are going to be test your knowledge questions. So I'm going to read the stem of the question, and then you guys are going to put the answers into the chat box. Okay. Disease-modifying anti-rheumatic drugs, or most commonly referred to as DMARDs, are used to treat rheumatoid arthritis. Select all that apply. Which drugs are DMARDs here? Anybody have an answer? B for sure, for sure. F for sure. One more, which is E, luflunomide. Okay, luflunomide. Luflunomide is one of those drugs that we need to counsel our patients about if they are of childbearing age. Luflunomide can cause severe birth defects if a woman should become pregnant while she's taking this medication. So that's why luflunomide is super important. A nurse is working in an outpatient clinic and is assessing a client who has rheumatoid arthritis. The client reports increased joint tenderness and swelling. Which of the following findings should the nurse expect? Select all that apply. Anybody agree with Zenaida? Well, You're right, okay? You are correct. So any kind of stressor, and an influenza infection is a stressor, can lead to exacerbation of RA, and so you would expect them to have some kind of a stressor in their life. They will have a decrease in range of motion of those joints, and they will have pain at rest, unlike osteoarthritis. A nurse is teaching a client who has a new diagnosis of rheumatoid arthritis. Which of the following statements should the nurse include in the teaching? How long is that morning stiffness going to last? How long can we anticipate it to last in the morning? More than 30 minutes. More than 30 minutes. Very good. Okay. This is a long one. A 58-year-old female is experiencing a flare-up with rheumatoid arthritis. While assisting the patient with her morning routine, the patient verbalizes a pain rating of 7 on a 1 to 10 scale in the right and left wrist, along with severe stiffness. You note the wrist joints to be red, swollen, and warm. What non-pharmacological nursing intervention can you provide to this patient to help alleviate pain and stiffness? Select all that apply. So the answer here is 2 and 4, actually, because what you want to do is when a patient has a flare-up with osteoarthritis, you want to rest that joint. You don't want it to exercise, because you're trying to protect that joint, and so you're not going to exercise it. You're not going to deep massage it, because that could lead to further damage to that joint and cause additional pain. So heat therapy is good for your patient. So a warm shower or bath helps to alleviate some of that stiffness that they feel. Okay, so sometimes cold therapy can also be used when there's a lot of inflammation, and a lot of times the joints will be splinted. Not with not in us. So why would we splint? You're going to splint to protect the joint in rheumatoid arthritis. You're going to apply a splint in rheumatoid arthritis when there is a flare-up. Okay, when there's a flare-up, not when the patient is stable. Only when there's a flare-up. We want to protect the affected joints in rheumatoid arthritis. Okay, so a warm shower or bath can help with increasing mobility, okay, and decreasing some of the stiffness that they experience. Okay, so this is a slide where I want you to kind of look at, compare and contrast rheumatoid versus osteoarthritis. So, rheumatoid arthritis, as we know, is an autoimmune disease, and osteoarthritis is non-inflammatory. So that's a mistake there on my slide. So the cause of rheumatoid arthritis is unknown, even though we know that there are environmental factors. We know that there's genetic links. In osteoarthritis, we're talking usually about the larger joints, the hips, the knees, the spine, sometimes the hands. And usually it's due to overuse syndrome, repetitive motion. You'll see it in people that work in factories who do the same motion all of the time. Rheumatoid arthritis can affect people in early age, as early as 20, and can be found all the way up into the 5th and 6th decade of life. Osteoarthritis usually affects people that are greater than 40. One of the things that's important to remember is that in rheumatoid arthritis, it's going to be symmetrical. So if I have a problem with my left wrist joint, I'm going to also have a problem with my right wrist joint. So it's symmetrical and bilateral. When we're talking about osteoarthritis, generally speaking, it's unilateral. It is not bilateral. It's not symmetrical. All right. So it's usually unilateral. So it'll be one, a hip joint on the left or a hip joint on the right, not both simultaneously. So when you palpate the joint also, it will feel very different in rheumatoid arthritis when you compare it to osteoarthritis. So in osteoarthritis, individuals, they develop osteophytes, which is the overgrowth of bone. So when you palpate that joint, you're going to feel that bony prominence, and it's going to be hard, and that joint's going to be stiff. Whereas in rheumatoid arthritis, that joint is going to be soft and warm, and it's going to be boggy, kind of squishy, if you will, at the joint, and also the joint is going to also be stiff. So in rheumatoid arthritis, some of you said that the pain is going to be upon arising in the morning. They're going to have pain and stiffness for greater than 30 minutes. Now in osteoarthritis, they're going to have pain and stiffness that lasts less than 30 minutes. So when they get starting to move during the day, they're going to have an improvement in their pain and in their stiffness. But as they go through the day and they use these joints over and over again, as the day ends, you're going to find that they have increased pain and stiffness. Any questions about the difference between RA and OA? The next slide is just comparing actually RA, OA, and gout. So we know that RA is autoimmune. There's some genetic predispositions. We do see it in families. There are certain things that can exacerbate RA. OA is usually age-related, overuse of those larger joints, some mechanical stressors, and of course, individuals who have an elevated BMI are at risk for osteoarthritis as well. Now, gout is a form of arthritis. There is a genetic link associated with gout, and it's related to the elevation of uric acid levels. So those uric acid crystals are deposited in an intra-articular joint, and that causes redness and swelling and severe pain. So if you know anybody who has gout, you know that they're usually in severe pain. So gout is exacerbated by a diet rich in purines. So people who drink a lot of beer or eat a lot of processed foods like sardines or organ meats or things of that nature or sugar's another big one, I almost forgot that one, can exacerbate gout. All right, a nurse is teaching a client about risk factors for osteoarthritis. Which of the following factors should the nurse include in the teaching? What contributes to OA? Age, obesity, and believe it or not, smoking, okay? Because, so it's actually not diuretic, so it's aging, obesity, and smoking. Smoking predisposes people to break down their cartilage, okay? Smoking is not a good thing. A clinic nurse is performing a physical assessment on a client who has lupus. Which of the following findings should the nurse expect? What kind of clinical manifestations are you going to have in a patient with lupus? Yeah. What's that rash called? That's the common name for it, Paige, but you as the registered professional nurse, what are you going to call it? The malar rash. That's a malar rash that is on the cheeks and goes across the bridge of the nose, because it does look like a butterfly, and that's why it's deemed a butterfly rash. A nurse is reviewing laboratory values for a client with lupus. Which of the following values should give the nurse the best indication of the client's renal function? Aha. Zenaida, why do you say it's creatinine? I already heard that was the best lab. Yes, you're right. It is the best lab to for renal function, for kidney function. Creatinine, when you're looking at a renal function, creatinine is much more of a specific and sensitive indicator of renal function. So BUN we also use that when we're looking at renal function, but that has to do with your gross index of glomerular function. But creatinine is more sensitive and it's more specific, and it gives you more information about your patient's renal status. Very good. A nurse is reviewing the cause of gout with a group of nurses. Which of the following statements should the nurse make? Yeah, the answer is 3. So what happens is that the urate crystals, they're going to deposit in the joint, they can deposit in the tissues, and it's going to lead to inflammation, and then it's going to be very painful for your patient. Sometimes if it's, like in their great toe, they can't even put a shoe on. A nurse is caring for a client who has advanced lung cancer. The client's provider has recommended hospice services for the client. Which of the following statements by the client indicates a correct understanding of hospice care? Okay, so the answer is number 2. They're going to help you, hospice is going to help a patient manage the manifestations of the terminal disease, and in this case, it's lung cancer. So they're going to help to manage those things that are going to cause the patient a lot of distress. Now, in order to get, number 3 is not right because, let's see, okay, so to be able to be eligible for hospice, they do have to have a terminal diagnosis, and they have to have a life expectancy of 6 months or less. That's the reason why that one is incorrect. Hospice can happen in an assisted living. It can happen in the person's home. There are hospice houses. Okay, so that's why that answer is not correct. But I want you to be thinking just like you're thinking. A client is starting on celecoxib to treat osteoarthritis. The nurse should instruct the patient to watch for and report which of the following adverse effects. Yeah, exactly. Number 1, because it can cause GI bleeding, right? And so we want our patients to report any black or tarry stools or bright red stools as well, abdominal pain, any coffee ground emesis, all those signs and symptoms that might go with a GI bleed. A nurse is preparing a presentation at a community center about osteoarthritis. The nurse should plan to include which of the following information? Select all that applies. So we're talking about OA here. Okay, Zenaida has it. 1, 2, 4, and 5. Don't forget, they're going to have joint pain and joint stiffness. They are going to have that. It's going to last for about 30 minutes when they get up in the morning. And as they start moving, that stiffness and that pain will improve until the end of the day, when they'll come back and rest after having used that joint all day long, and they will experience stiffness and pain once again. A nurse is providing teaching to a client about preventing skin cancer. Which of the following client statements indicates a need for further teaching? Definitely. So what kind of cancer are we trying to prevent when we encourage high fiber diet? What kind of cancer are we trying to prevent? Colon cancer, not skin cancer. Remember, number 3, what kind of cancer are people have increased risk for if they spend a lot of time in the tanning booth? What kind of skin cancer? What kind? Specific? Malignant melanoma. Okay, and that carries with it a poorer prognosis. And remember, everybody needs sunscreen, rain, shine, and it doesn't matter what your Fitzpatrick score is, okay? Everybody needs sunscreen. A nurse is teaching a client who has a new prescription for colchicine to treat gout. Which of the following instructions should the nurse include? None of the above. Yeah, it's number 2. What are they at risk for? If you chose number 2, what are they at risk for? Why are you going to monitor them for muscle pain when they're getting colchicine? What are you monitoring for? You're monitoring for muscle pain, but why? Because they're at risk for rhabdomyolysis. They are at risk for rhabdomyolysis, okay? So colchicine, we use that for patients in the acute phase of gout, and we use allopurinol as a maintenance drug to reduce hyperuricemia or uric acid levels. So colchicine is acute, allopurinol is maintenance. If I saw this answer on any test, I would probably never choose this, because you guys know that grapefruit juice interferes with the metabolism of many drugs, right? Correct? You know that? Yes. So if I saw this, automatically I think that I would exclude it if I was having a problem figuring out what my answer is. Just as an FYI. A nurse is instructing a client who is starting methotrexate to treat rheumatoid arthritis. Which of the following instructions should the nurse include in the teaching? So Paige, why did you choose number 4? It's harmful to the kidneys, yes. So it's nephrotoxic, so it can lead to kidney damage. So you want to make sure that they're drinking 2 to 3 liters of water per day, that they have so that they can adequately excrete the drug from the renal system. Now, usually patients who are taking methotrexate. For rheumatoid arthritis, are taking it weekly, not daily, okay? So that's why that answer is incorrect. Remember, we use methotrexate to treat a multitude of things. We can use it in autoimmune disease, we use it in cancer, we use it in ectopic pregnancy. So it's a drug that's very versatile. A nurse is planning care for a client who's being treated with chemotherapy and radiation for metastatic cancer and who has neutropenia. The nurse should include which of the following restrictions in the client's plan of care? Yes, very good. So what are some of the things that you're going to do besides restrict fresh flowers and potted plants when your patients are neutropenic because they're at risk? So what are some of the things you as the nurse are going to implement? Cook foods, private room, too many visitors, limit visitors, and limit those visitors to make sure that to ensure that they're not sick. Good, oh yeah, good hand washing, reverse isolation for the people that are entering the room, the staff, those kinds of things. And don't forget meticulous hygiene for our clients, because a lot of times our patients, after they receive treatment, they don't feel well, they're very fatigued, they may be having fevers, and they don't want to shower. But it's especially when you have a central line that's accessed, sometimes they can get an infection from their own normal flora. So we want to make sure that they shower. So fresh fruit is one of those things that is restricted, and I just want you to know that there's a lot of controversy about these neutropenic precautions, and it depends on your institution how they handle that. But I'm going to tell you that they need to be cooked, but really they need to have a thick peel on them. So you're going to prefer to give them an orange over giving them strawberries, for example, because that orange is protected in a thick rind. Okay, does that make sense? And you can remove that. So yes, fresh fruits, and salads, for example, salads aren't a good idea for the obvious reasons. It's not protected. To grapefruit, no to peaches. I would say yes to that. I would say that's exactly correct. A nurse is teaching a client who has rheumatoid arthritis about increasing physical rest as part of her treatment plan. Which of the following outcomes of this intervention should the nurse document as a goal for this client? I think we've already covered this. What are we trying to do when we rest the joint? We're definitely doing that. We're reducing joint stress. And if we reduce joint stress, we protect that joint and we protect the joint function. So that is what we are doing when we are resting the joint. We are reducing the stress on that joint so that we can maintain joint function. Because remember, in rheumatoid arthritis, what happens as time goes on and there's more exacerbation of this disease process, that joint becomes smaller and smaller and smaller, and the joint ends can become fused together. And so no, this is not a select all that apply. It's the answer is one, but I want you to see how it flows, that we're reducing joint stress because we're trying to preserve joint function, okay? And we're trying to prevent ankylosis, where the joint is fused together, all right? So joints, remember, are made to move. If it's fused together, it's not going to move, and these individuals lose their function of that particular joint. So we're trying to protect it. A nurse is teaching a client who has osteoarthritis. Which of the following instructions should the nurse include in the teaching? Okay, the answer is 3. So osteoarthritis, the drug of choice for them, remember I told you it's non-inflammatory, even though that slide that I had earlier said inflammatory, that was a typo on my part. So the drug of choice for treating osteoarthritis is acetaminophen. So decreasing foods high in purines would be for which type of arthritis? Which type of arthritis do we want to alter the diet? So gout. Purines is associated with gout, okay? A nurse is caring for a client who has a suspected diagnosis of myasthenia gravis. The provider prescribes a tensilon test. Which of the following findings indicates a positive test? Make a choice. Make a choice. Commit to the diagnosis, Zenaida. Commit to the answer. Okay, like that. Number 2 is that's your commitment. Do the rest of you agree with Zenaida? Yes. So actually that is correct. So what is the generic name for tensilon? Edrophonium. Edrophonium. Okay, that's the name for tensilon. So remember that when you suspect the diagnosis of myasthenia gravis, we're going to do a tensilon test. And so if the patient has myasthenia gravis, they will improve. Their signs and symptoms will improve because you're adding acetylcholine to that neuromuscular junction. So within 4 to 5 minutes, you're going to see that there's an improvement. Yes, less weakness. You're going to see an improvement in strength. If the patient doesn't have myasthenia gravis and you do the tensilon test, there will be no change. There'll be no change in muscle strength. Okay, got it? Now, this one is actually the opposite. So I think I have another question in here about electrical stimulus, or maybe not. I have that actually probably in the lecture that I posted for you. So this has to do with EMG findings, and the answer to this would actually be a decrease in intensity, okay? A nurse is assessing a client for lupus. Which of the following findings is the highest priority for the nurse to report to the provider? Why do you ladies say 3? What's your rationale for that? What are you worried about? Kidney failure. It's more, and of course, remember that that lupus can affect any organ system, right? And it can affect the heart. But if I saw peripheral edema, not that it can't be cardiac related, but I'm going to be thinking about nephritis or nephropathy. So I'm going to be thinking renal in this particular situation, okay? Impaired renal function. Very good discernment there. A nurse in an acute mental health facility is creating a plan of care for a new client who has histrionic personality disorder. Which of the following is the priority intervention for the nurse to take? So communicating with them using concrete language is one of the tools. It is one of the interventions that we talked about and we would utilize with this client. But what's your priority intervention? It's actually number one. Yeah, you're going to promote appropriate behavior during group therapy sessions. Why do you need to promote that with these individuals? What are their characteristics that would make them disruptive? They're extreme attention seekers. They're very dramatic. Yes, they use their sexuality to gain attention, right? And they're very impulsive. Okay, so you want to model appropriate behavior and set those expectations early. Okay, I like that you know the characteristics of histrionic, and I hope you know them for the other 9 as well. That's those are the mean girls, right? A nurse is planning for a client who is post-operative following a liver transplant and weighs 65 kilograms. Which of the following actions should the nurse plan to take? Not plant, but plan to take. You guys agree with Carrot? Okay. So we have 3 and 4 on the table. Who's going to break the tie here? Yeah, it's number 3. So Carrot, tell us why you chose number 3.
I chose number 3 because when you're dealing with someone that just had like a liver transplant, you're I don't know how to word it, but you're dealing with bacteria. You don't want to have anything that's going to cause some type of infection.
Okay, so surgical is one reason, but what's another reason specific to the transplant? What do transplant patients take medication-wise?
Oh,
They take immunosuppressants, right?
Immunosuppressants.
Yes, and that increases their risk for infection. So we want to stress the importance of safe food handling practices, okay? So number 1 isn't right because usually a patient post-operative, we're gonna feed them in 2 to 4 days, somewhere around there. And we don't wanna limit their carbs because they're gonna need that. They're gonna need extra carbs because of the stress of their surgery. So we don't wanna limit carbs, and we don't wanna limit caloric intake at this particular time. So we want to make sure that we got to be thinking all the time about what kind of patient it is, what are their ramifications. And here, remember, in this group, we're talking mainly about patients who are immunocompromised. Not all of our patients are immunocompromised, right? But a lot of them are in this particular section. A client is receiving treatment for stage 4 ovarian cancer and asks the nurse to discuss her prognosis. The client plans to have aggressive surgical, radiation, and chemotherapy treatments. Which of the following prognosis should the nurse discuss with the client? Patient has stage 4 ovarian cancer. What does that mean? Okay. All right, so I want to go back to what some of you said. What is the definition of stage 4? What's the definition of stage 4? Spread where? What is the definition of metastasis? This is important for you guys to know. Distant sites, distant sites. That is the definition of stage 4. So stage 4 carries a very poor prognosis. So the answer is number 3. So remember to look up the stages. Okay, so stage 4 is metastatic disease. That means that that cancer has traveled to distant sites, and this patient has a poor prognosis. A nurse suspects a client who has myasthenia gravis is experiencing a crisis. Which of the following interventions should the nurse take? Do you guys agree? Everybody agrees with the answer that we're going to administer anticholinesterase? Carrot wants to have mechanical ventilation available. Who's going to be the tiebreaker here? Okay. So carrot is correct. So in myasthenia gravis, especially when there's a crisis, a myasthenic crisis, they are at risk for acute respiratory failure. So they're going to require mechanical ventilation. So you need to prepare for mechanical ventilation with these particular individuals. So go back and look at myasthenic crisis versus cholinergic crisis, okay? So you don't want to administer more anticholinesterase medication in this particular situation during this crisis, because it may increase some respiratory secretions. A nurse is teaching a client who is to begin long-term therapy with prednisone to treat rheumatoid arthritis. The nurse should instruct the client to take which of the following supplements while taking this medication. So what supplements is the patient going to take if they're getting prednisone to treat their rheumatoid arthritis? What is your rationale for 1? What's the rationale? Why do you need to replace calcium and vitamin D? What is the patient at risk for? Prednisone is an immunosuppressant, but why are you giving them calcium and vitamin D? Bone loss, that's why. So bone loss, you want to avoid compression fractures, right? So we want to supplement osteoporosis. They're at risk for osteoporosis. If they're at risk for osteoporosis, they have bone loss and they're at risk for compression fractures. So calcium and vitamin D is the appropriate supplement for patients that are on long-term therapy for steroid therapy. A nurse is preparing to administer oral medication to a client with myasthenia gravis. Which of the following actions should the nurse take prior to administering the client's medication? You have to assess swallowing, right? And so before I was going to give any oral medication, I would want to make sure that my patient is able to swallow. Because remember, with myasthenia gravis, we have weakness of that skeletal muscle. And so that includes the respiratory muscles, any muscles for our arms and legs, facial muscles, the muscles that we use to swallow, the muscles we use for phonation, our extraocular eye movements, all of those kinds of things. And if I really am concerned about aspiration in this particular patient and I'm not sure they have a safe swallow, who can I ask to help me with that in the hospital? Who can help us with that? Yeah, speech language pathology. They're going to assess safe swallow, and they're going to tell you what the consistency of the diet should be for these particular patients if they do have an impaired swallow. A nurse is teaching a client about the 7 warning signs of cancer. Which of the following signs should the nurse include as manifestations of cancer? Select all that apply. Exactly. So a non-healing sore, a change in bowel pattern, a change in the size, the color, the border of a mole, and a nagging cough. Bloating is not one of the 7 warning signs of cancer. Very good, guys. A nurse is completing discharge instructions with a client following an acute onset of gout. Which of the following client statements indicates an understanding of the treatment regimen? Yeah, we know that alcohol exacerbates gout, and I think beer is on the list, the highest, it's high on the list for patients with gout that can precipitate it. A nurse is teaching a class at a community center to a group of young adult, middle-aged, and older adult clients regarding screening recommendations for cancer prevention. Which of the following information should the nurse include? So the answer is number 3, okay? The recommendation is yearly fecal occult blood testing. That's a recommendation by the American Cancer Society. The American Cancer Society says that clinical breast examination, that's a professional breast examination by a trained provider, begins at age 40. At what age for patients that are at average risk should they receive a colonoscopy? At age 50, and if there are no polyps, they can have a repeat in 10 years. And when do we start the yearly mammogram for women? When is it recommended by the American Cancer Society? Age 40. Very good. Okay, so the answer here is number 3. A nurse is caring for a client who has am I in the right? A nurse is teaching a client how to follow a low purine diet as prescribed by the provider for the management of gout. Which of the following statements indicates the client understands the teaching? So liver and organ meats are high in what? What are they high in? What are we trying to reduce? They're high in purines. They're high in purines, okay? So organ meats, liver, tuna, sardines, things like that, okay? And so we don't want them to limit their fresh fruits and vegetables. We want their diet to be clean, basically. We want them to have things like eggs and legumes and fresh fruits and fresh vegetables and lean meats and limit their alcohol, no red meat, okay? A nurse is caring for a client who has cancer and a new prescription for ondansetron to treat chemotherapy-induced nausea. For which of the following adverse effects should the nurse monitor? Excellent. Patients who get Zofran or ondansetron a lot of times will have a headache, and so you'll need to give them an analgesic for that headache. And they don't have polyuria when they get ondansetron. They're at risk for urinary retention. Okay, the other two and 4, have nothing to do with that particular medication. A nurse is caring for a client who has paranoid personality disorder. Which of the following findings should the nurse expect? Select all that apply. Yeah, 1 and 5. So they believe without any basis that other people are deceiving them, and they persistently hold grudges. Which one of the personality disorders are attention seekers? Histrionic. Which personality disorder thinks that they are inferior to others? Not those two. The avoidant, yeah, avoidant personality disorders. Really deep down inside, they feel like they're inferior to others. They're always worried. They're constantly worried about being criticized, and they don't ever fully engage in new interpersonal relationships. Okay, that's avoidant. And now, who's the grandiose person? Michael Jackson, exactly. Michael Jackson's. That's why I didn't think avoidant. So House, and what is House, Paige? What is he? What personality disorder? He's a narcissist. Yeah, he's a narcissist. So you guys are doing great. I'm glad to see that you guys can pick these people out by their characteristics, or these personality disorders by their characteristics. So a nurse is planning discharge for a client who has borderline. Which of the following interventions should be included for the client? This one might be a little difficult. Okay, so I threw you off here by putting dialectical behavior therapy. That is the answer. It is a form of cognitive behavioral therapy. And so with these patients, we do want them to get cognitive behavioral therapy. Now, I'm not going to disagree with you, but you know, if they have suicidal ideations, or they have attempted, or they have self-harm, then of course a safety plan. But what we're really going to do with these people is try to hopefully get them to see how unproductive their behaviors are, and how detrimental they are to the individual and to the people that love them, actually. A nurse is caring for a middle-aged adult client who has just received the diagnosis of endometrial cancer. In taking a nursing history, which of the following manifestations is likely to be reported by the client? Yeah, people that have endometrial carcinoma, that's cancer of the lining of the uterus, they usually will have post-menopausal, they'll have abnormal uterine bleeding for sure, but that usually is post-menopausal bleeding or bleeding that occurs between normal periods in women that are premenopausal. So those are the highest risk groups. Extreme pain with intercourse is usually patients who have endometriosis, okay, endometriosis. A nurse assessing a client who is 2 weeks post-op following a kidney transplant. Which of the following manifestations should the nurse identify as possible rejection? Do you guys agree with Paige? Definitely, definitely. So you're going to see a change in urine output. That's why it's so important that you're monitoring the patient for their urine output. A nurse is discussing kidney transplant with a client who has end-stage renal disease. Which of the following should the nurse identify as a contraindication for this treatment? Yeah. Alcohol or substance abuse is a contraindication for transplantation. A nurse is caring for a client who has borderline. As part of the client's plan of care, the nurse reviews the day's schedule with the client each morning. As the nurse begins to review the schedule with the client says, "Why don't you shut up already? I can read it myself, you know." Which of the following responses should the nurse give the client? So the most therapeutic answer here is number 2, right? You have to set those boundaries. Remember that the borderline personality disorder patients, they are emotionally unstable. They have these type of outbursts. And so you need to set boundaries and use concrete language to do so in order to deal with them. Okay, so not allowing them to talk to you in an inappropriate way. And remember that when we use closed-ended statements or questions, or we're not using open-ended, then we kind of cut off that communication, and then it becomes non-therapeutic, if you will. Okay, so the answer here is number 2. A nurse is teaching a client who has lupus about self-care. Which of the following statements by the client indicates an understanding of the teaching? The answer is number 3, okay? So we're going to use mild shampoo, and that probably seems like it's kind of weird, but it's because these patients can have alopecia, all right? So we want to use a mild protein-based shampoo. I'm starting to confuse them. Yeah, don't get confused, okay? Just know that we're going to use mild hair shampoo for these particular individuals. Just go back and review them. The nurse provides home care instructions to a client with lupus and tells the client about methods to manage fatigue. Which statements by the client indicates a need for further instruction? Why do you say number one, Zenaida and Carrot? Why is it number one? Heat is a trigger, and heat will zap your energy, right? Think about yourself when you get into a hot bathtub or a hot tub. How do you feel when you get out? Your energy is just zapped from you, so it exacerbates fatigue. So we don't want that. We want them to take a warm bath or a warm shower, but we don't want them to be drained. Okay, so very, very good rationale. We only have 5 left, guys. A nurse is reviewing the plan of care for a client who has lupus. The client reports fatigue, joint tenderness and swelling, and difficulty urinating. Which of the following laboratory findings should the nurse anticipate? Excellent, excellent. So in the lupus patients, they're going to have a positive anti-nuclear antibody or A titer. Um, um, they can have some protein, they're spilling protein in their urine, and they could have an elevated BUN. They could also have an elevated creatinine as well. So C3 and C4 is complement, is a protein complement. And so these complements, if you look at my recording from earlier today on lupus, if you haven't read about it, I hope you'll be able to understand it. When we have an exacerbation of lupus, for example, that they're going to deplete their complement, so they would actually have decreased serum C3 and C4, and they would probably have a decrease in their hemoglobin level as well. Okay. A nurse is assessing a client who has lupus. Which of the following findings should the nurse expect? Select all that apply. I don't think that's necessary. You don't need to select all that apply. Yeah, they're going to have alopecia. That's why we're going to use that mild soap. Okay, they could have alopecia. A nurse is caring for a client who has lupus and is experiencing an episode of Raynaud's phenomenon. Which of the following findings should the nurse anticipate? Yeah, so their digits, their toes or their fingers are going to get pale, or they're going to become cyanotic when they're exposed to cold. So that's called Raynaud's phenomenon. The nurse is teaching a client with myasthenia gravis about the prevention of myasthenic and cholinergic crisis. Which client activity suggests that the teaching is most effective? Definitely, it's number 4. We want to make sure that they take their medications when they're supposed to take them to maintain therapeutic drug levels. We don't want too much in their system at any given time, and we don't want too little. And in these type of patients, in the patients with myasthenia gravis, we want them to eat well-balanced meals, but we want them to eat small meals. We don't, okay, so so if you do muscle strengthening exercises, that's not going to do a thing for myasthenia gravis. Remember, the problem exists at the neuromuscular junction. So doing all chores early in the day while less fatigued. That's probably what your textbook says. And of course, when they have more energy in the earlier part of the day, we do want them to do their chores. And so I would accept that answer, but we want that to be paced. We don't want them to do those chores all at one time. Does that make sense? We want them to conserve their energy and do a little bit now and a little bit later. But I'm sure that your book tells you that to do the chores early in the day, correct? So I would accept that answer. Okay, so, but really here, the best answer, the most effective teaching tool would be taking your medications on time to maintain a therapeutic drug level. Which patient below is most at risk for developing a cholinergic crisis? Which patient? So we're talking about cholinergic crisis here. Yeah, the patient who reports taking too much medication is at risk for a cholinergic crisis. Okay, so they're taking too much of their medication. Okay, and that's it for tonight. So remember that I have a lot of tools for you on Blackboard, on the announcement board, I should say. There should be 4 videos up there. We did the prep tonight, and also I gave you a tool, or it's actually a game on the internet that you can use to test your knowledge of personality disorders. Before we go tonight, do you have any questions? Please, no, okay. Please don't forget, if you haven't already done it, please don't forget to download your exam so that you can get that done and out of the way, and you don't have that to worry about, so that when you get to the examination, you're ready to spend some time alone in your own thoughts, centering yourself and preparing to take that examination. You can do this. Positive energy, positive thoughts brings about positive responses. So everyone should be positive. Make sure that you ask yourself, what is this question asking me? Don't get bogged down. You have been preparing for this day, and you can do it. I have faith in each and every one of you, okay? Remember that I'm here if you should need anything, and on Friday morning, prayers will go before you ever sit down to take that examination, petitioning for your success on the exam. Thank you guys for coming, and I will be in touch with you very soon. Please let me know if you need anything. I'm just an email away.